Good afternoon. We have with us Dr. Shankar Sen, physician, Maharaja Agrasen Hospital, Siliguri, and we welcome you to the Natco Pharma Specialty Studio. We look forward to listening to you for the advice you can share with the young generation of doctors. Those are associated with critical care and with antibacterial resistant treatments. How do you foresee the changes in the critical care management space?
But regarding because we are discussing antibiotic resistance, and that is the most important thing we should take care. See, when you get a septic patient in our ICU, initially, definitely, according to all guidelines, to save the patient, we have to start with the empirical antibiotics, and that will be mostly a combination with coverage of gram-negative, sometimes gram-positive also, and if needed, anaerobics also. But what is important is we should take care that we should be careful that we have to send the cultures immediately. We shouldn't delay, and also we can do the procal and the CRPs. If there is, then on follow-up, when the cultures come, we need to de-escalate the antibiotics as early as possible if the patient is improving within 3 days when the cultures come. Nowadays, it's important because we can also follow it up with procalcitonin levels, serial measurements. If we do that after 2 to 3 days again, if the procalcitonin is going down, then also we can de-escalate the antibiotic. So not the escalation, but the de-escalation of antibiotics, pinpointing the antibiotic which is needed for that particular organism is very important. And one important thing I can tell, nowadays we have such important diagnostic tools, a bit expensive, but it reduces the cost of hospital stay. If we can do a testing like a biofire for a sample from the endotracheal tube or a sample from any other body fluid, and the biofire, the result comes in 2 to 3 hours. It's expensive, but if we can diagnose my bacteria early, which my patient is suffering from, I can pinpoint better antibiotics or a specific antibiotic and thus decrease the resistance also, and also decrease the ICU stay and also the hospital stay of the patient. These are the current advancements which we are using nowadays.
Thank you so much for that insight. What is the one thing you would like to tell the young doctors that are in ICU, uh, how they can best enhance patient care?
And definitely, because you have to be up to date, you have to attend conferences, you have to go through the recent guidelines, and also be in touch with your labs like the microbiology department, which is very important. You are seeing patients, we are all seeing patients, but the guidance can come from our radiologist, from our microbiologist, from the pathologist. We need to have a teamwork. I am working in the ICU, that's not enough. I have to be in touch with the physician, with the critical care specialist in your team, and also definitely the labs.
Great. Doctor, what is the prevalence of carbapenems in your line of treatment?
See, it's quite important because I can't give you exact statistics, but what is important is quite important because we get carbapenem resistance in certain cases, and definitely there we have to escalate our antibiotics. And not in all cases. In our city, in Siliguri, we don't get so much of Acinetobacter, but we get more or less more drug-resistant MDR, Klebsiella, and all these, and the gram-negative bacteria, which are my MDR. So keeping those in mind, we should start our treatment.
You did speak about treatment in your very first answer to the question, but what is the best options you would like to sum it up if you have to discuss that with us?
Definitely, whenever a patient comes with sepsis, we have to go immediate testing for the urine cultures. We have to send the chest X-ray, and as I said, so if there is pneumonia, if we think of some gram-positive infection, we can add a gram-positive from the beginning until and unless the reports come. But gram-negative coverage is most important, and in certain cases, anaerobic coverage also we should think of at the beginning, and then de-escalate according to our reports as per patient's improvement, and then gradually we can pinpoint which antibiotic to continue.
Dr. Sen, thank you so much for your time. And on behalf of Natco Pharma Specialty, I wish you all the best in your practice.